This is a really rare genetic condition where this particular child, did I tell you guys about this case? Where the fourth finger bilaterally, the child has no bone, it's just all cartilage. It's cartilage from the MP all the way up to the tip. One solid block of cartilage. And then the third digit, there's normal mobility at the MP and hypermobility into flexion at the DIP bilaterally. So, but there's virtually no movement at the PIP. So the fourth and fifth fingers for this child are sticking out like, just sticking up straight, except that the middle finger, there's full DIP flexion. So the child grasps things by, everybody try to just do isolated DIP flexion. Like, suppose you're going to try to pick something up. Like, you guys can't isolate out probably DIP flexion from PIP flexion all that well, unless if you block it. See, if you block it, you can, get all that flexion. This child, just does it naturally. Okay, so it's really kind of interesting. So anyway, this child went to Mayo Clinic to have this surgery done. There's a surgery that was dreamt up by a couple of surgeons in South Korea, and then some people from Mayo Clinic went over and learned the strategy of how to do it, and they actually wrote an article on it. But even with the surgery, the best hope for mobility at the PIP is maybe around 40 or 45 degrees, and a lot of kids only get 10 or 15 degrees of mobility. Basically, they have to, so they had to go into the back of the DIP, the dorsal side, think anatomical position, the dorsal side of the hand, and they have to release, and then they have to shave down the bone and try to reconstruct the joint at the PIP. So he is 8 months old, 9 months old. And it's a really tough situation because when he first came in, he was post-surgical, so he was in a lot of pain still. And the recommendation from the doctor is to just do as much passive range of motion as possible. And it was a really, very, very difficult situation because the child didn't want anyone to touch his hands. So it took us about 3 weeks of a home program with the mom just for him to tolerate being handled. And a lot of it was really hard. He had internal stitches, and so the stitching was still all dissolving and coming out through the skin through those first few weeks. So his fingers were raw and red and angry and painful looking, and he just didn't want anybody messing with him. And his response, of course, was to stick his fingers in his mouth. But he was also kind of cute because, he would come into therapy, he'd sit down, and he would do this with his hands. He would stick them in between his legs. He was so smart. He knew exactly where he was and what people were going to try to do to him. So he was already developing strategies to make sure no one was going to touch his hands. So that's a very, very challenging case that we have right now, and is still ongoing. So he's healed well. And he's not sensitive anymore, so he'll let us hold his hands and even do a little bit of range of motion. So there's a lot of improvement that way. His functional mobility is really, really constricted, really just negligible. So I'm not sure how successful the surgery is going to end up being for this young fellow. Kind of tough. So that was a tough case. And is a tough case that we're still kind of coping with. Very hard to work on orthopedic problems for a young baby who has no interest in cooperating.